Welcome to She Found Motherhood. Today we speak to Lanie about her magical birth with her baby girl, Brinley. She speaks of the importance of prenatal education, not so much for the labor delivery experience, but more for that postpartum experience with your newborn. She also talks about how she really tried to manifest the birth that she wanted, and luckily for her, she got it. Now, she also prepared because she's a labor delivery nurse and she knows how things can go sometimes. She also mentions her use of spinning babies and a TENS machine and the importance of pelvic physio. We'll get to her story right after this.
Welcome to the She Found Motherhood podcast. We are doctors Sarah and Alicia, maternity physicians and moms who have been through it all. We want to empower you with knowledge so you can have the best pregnancy, birth, and postpartum experience you can.
She Found Health and She Found Motherhood is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This information does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. The views expressed by She Found Health and She Found Motherhood and our guests are not representative of any of the institutions with which we are affiliated. Some of our podcast episodes are sponsored so that we can keep getting great info out there to you, our listeners. We only partner with companies that we truly believe in. Some of our links and suggestions may be affiliates, and we would appreciate you using them to help fund this important work. Now let's get to it. Welcome, Lanie, to the She Found Motherhood podcast. Today, we are going to hear all about your birth story, and you actually have a really interesting perspective. So why don't you start by telling us a little bit about yourself, and then we'll get into it.
Okay, well, hello, good morning. I am Lanie, and the interesting part is that I'm also a labor and delivery, postpartum, and pediatric nurse in Duncan, BC, Canada. So I do have a little bit of a different perspective, I guess you could say. I am married. I have a dog who is my firstborn.
Who is very cute and lying on the couch next to Lanie right now.
He's very chill, a golden retriever. And I also have an almost 5-month-old daughter named Brinley.
Awesome. So why don't you start by telling us a little bit about your experience as a labor delivery nurse and how that kind of changed your perspective going into kind of pregnancy and birth?
Yeah. So I've been a labor and delivery nurse for, I think, 5 or 6 years now. And what I've learned is that I knew nothing about pregnancy. I know how to be a nurse for pregnant women, but I had no idea what it would feel like to be pregnant, how to cope with those symptoms, how to manage life while pregnant. And I've learned a lot throughout this whole journey, which is, I think, going to help me as a nurse. Yeah. Sorry, what else did you ask?
And kind of what were your expectations going into? Well, you know what, let's get to that later, but I agree with you totally. I'm a maternity doctor, right? So I care for pregnant people, postpartum people, and I have for, I don't know, a long time now. It seems longer than it should be, but actually going through it myself gave me a whole new perspective, and especially the postpartum, like newborn parenting, breastfeeding piece.
Yes.
Like game changer.
Absolutely.
So that's interesting to hear you say that as well. And I think
I knew nothing.
Yeah, right. And the care we're able to provide now is going to be so much richer because of our own experiences.
I think so.
Yeah.
I often wonder, how did I educate all of these new parents on the postpartum journey when I hadn't been through it? And I have a completely different perspective now.
Yeah. So why don't we talk a little bit about kind of your pregnancy and how that went for you?
Sure. So we got pregnant in February of 2020. And I swear the moment I took the test, I had nausea. I think I was almost 4 weeks pregnant at that time. And the nausea did not go away for the entire pregnancy. I went on diclofenac, I think at about 6 weeks. And then the nausea, vomiting worsened probably about 12 to 16 weeks. And then it had like a light at the end of the tunnel. I thought I was getting better, tried to decrease the diclofenac and I couldn't. So I just ended up having to stay on it the whole pregnancy, and that worked well. But I did have the nausea right up until I delivered, and then it just magically went away immediately, which was fabulous. I also suffered from a lot of pelvic girdle pain. So I went into pregnancy thinking that I was decently fit. I hike and walk lots, that kind of thing. And I had no idea how much pain we could experience in pregnancy. And working as a labor and delivery nurse was very difficult.
Yeah, so lots of nights. Yeah, lots of night shifts. busy shifts, I bet, running
Yeah.
around if it's anything like our unit. Like oftentimes you don't actually get
Lots
much of
of,
a break.
yeah, lots of running around. I actually did. So we do a little bit of labor and delivery postpartum in pediatrics. So I did kind of get to avoid labor and delivery a little bit. This was also, I found out that I was pregnant the week that COVID became a pandemic. So that was a very, very anxiety inducing experience. I was also super, not only nauseous, but really dizzy feeling and lightheaded at work specifically. And then having to wear the mask was, I don't know, it was a whole new experience. So I did kind of avoid being a little bit of a labor and delivery nurse, the primary nurse, for a while. And that helped, where wasn't stuck in the room for an entire shift.
Yeah, and often getting into really awkward positions to listen to babies around kind of the laboring person's kind of preferences and stuff. Yeah, I remember. So during
Absolutely.
my delivery, I did a lot of my laboring on the toilet. And my poor labor delivery nurse had to like get down on the ground in the
Yeah.
bathroom to listen to my baby. Like the positions and the willingness to support pregnant people and laboring people is just beyond amazing from our incredible labor delivery nurses. So note to
It
everybody
really
out
is.
there, thank your labor delivery nurses.
Yes. Oh yeah. Would leave a shift with a sore back always.
Yeah. How did you manage the pelvic girdle pain? Did you do pelvic physio or anything like that?
I did. So I'd seen a pelvic floor physio prior to becoming pregnant, and I kind of built a great relationship with her, and she's my normal physiotherapist as well. And so I saw her just kind of preventatively in the beginning. And then I started to get the pelvic girdle pain. So she gave me exercises that I did daily, and that helped amazingly. And then it also got so much worse, that I started doing chiropractor, and as well, I did massage regularly throughout pregnancy. But I would say that the exercises that the pelvic floor physiotherapist gave me was the most helpful.
Awesome. Yeah. And we're huge proponents. Again, I did not know much about pelvic physio before Sarah and I started doing all this stuff with She Found Motherhood. And I wish I had during my pregnancy. And I should probably still go see one now, but there you go.
Yeah,
Um,
every woman should.
all right. So kind of working through pregnancy, nauseous through pregnancy, this pelvic girdle pain. What about kind of how being a labor to delivery nurse, what were your expectations going into your delivery experience? You're into that kind of end of pregnancy, childbirth kind of period.
Yeah. So I had this birth that I envisioned my entire pregnancy. I told my coworkers, my friends, everyone about this birth where I labored at home for as long as I could. I came to the hospital almost fully dilated, and I just had a beautiful, magical birth, a healthy baby and a safe delivery. Did I think it was going to happen? Absolutely not. I thought I was going to end up in an emergency C-section, have all of the things go wrong, all of the bad things and scary things that I see as a labor and delivery nurse. I thought was going to happen to me is, if you have nurse friends who are labor and delivery nurses, or even just nurses in general, they call it the nurse curse or the doctor curse when you give birth. We seem to get the scary stuff happen, but I somehow got to miss that. So I really did think that I was going to end up in kind of a traumatic delivery, especially because during my pregnancy, I did experience some of the more traumatic births that I'd ever seen in my career. So that kind of induced a lot of anxiety and fear. But I really tried to do a lot of mindfulness and just really manifest this picture perfect birth, which I think really helped my mindset, just kind of being open to whatever happens. My birth plan was a healthy baby and a safe mom.
Yeah, awesome. And we've actually been starting to post more kind of like pregnancy and birth affirmations because it's true, right? That mindset is really important. It's also, obviously, as you know, we're very pro education and understanding all the potentials and why those things might happen. But it's also really important to kind of shift that mindset from kind of that. A lot of people are fearful and anxious around delivery to kind of as positive as you can while having those realistic expectations in the back of your head. So it sounds like that's kind of what you were doing through that period.
I tried.
That's all we can do is try, really. And Miss
I think
Brinley
I
is
have to go get the baby.
okay, let's pause it. You go get the cute baby. All right,
Let's
everybody.
FaceTime.
Yeah, Miss Brinley is joining us on the Zoom recording here. So she'll pipe up every once in a while, and that's lovely. Okay, so we're kind of chatting about your delivery experience. So why don't you start telling us about kind of the labor and how all that went?
Yeah. Do you want like specifics on times or
Sure.
anything?
Sure,
Or
if you
okay,
want, whatever you want to share.
we'll see how it comes out. So I was 40 weeks And one day, and I had a sleep at my midwife's office in the evening, not thinking that anything would happen from it, hoping and wishing, but I went into the night with nothing. I woke up a few times overnight, cramping. It felt mostly in the front, worse than my period. I fell right back asleep. In the morning, I think at around 9 o'clock, again, cramping a little bit irregularly. I must have thought something was going to happen because I showered, I shaved, I curled my hair. Got ready for the day, things that I definitely was not doing at 40 weeks pregnant normally. I had a chiropractor's appointment, I think at 11 o'clock in the morning. And I remember telling the lady at the front desk, oh, I think I might be in early labor. And she's like, oh, ha, 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 that could last for days. Thinking, oh, gosh, I could, who knows? And after my treatment, I think at about 11:30, I think this is actually early labor. These contractions they're happening. Fast forward an hour later, I call my husband and I say, pretty sure I'm in early labor. Who knows? This could last for days, but I'm giving you the option to come home and have a nap and prepare for a long night ahead.
You are such a
And
champ. That is a very lovely thing to do for your husband.
well, he does not do well on no sleep, so wanted a present husband. And so I think he got home maybe an hour later. Definitely in early labor. I remember bouncing on the ball, talking to my friend on the phone. She's like, you're in early labor? Oh my gosh, I have to call you. And we were chatting. And then I almost got to the point where I couldn't talk through the contraction. I thought, oh, okay, this must be happening. Who knows how long it's going to go on for. And then maybe about 2 o'clock, definitely let's say early labor. Could not talk through them. Couldn't really find a comfortable position. I found bouncing on the ball and standing was kind of the most. I got my husband to do like some spinning baby releases with me. So we did the sideline release and the inversion because I knew that the previous night I had learned that baby was a little bit posterior, kind of not in the most ideal position for labor. And so we did that. I think another hour went by and it's like, okay, I should try the bath. The bath did not help. I think things just started to intensify quickly. And it's like this, I just remember yelling out to him, this is not relaxing. This is supposed to be relaxing. I tell everyone to get in the bath. I think I must have been past the point of needing a bath. And I called the midwife and thought I should let them know, I think I'm in early labor. I'm probably just having a long posterior baby, early labor. And, we agreed that I would call back in a couple of hours, or they would call back in a couple of hours if they didn't hear from me. And I got out of the bath. I started using the TENS machine, which I don't know if it helped, but it definitely was kind of a good distraction. And it felt kind of cool with pins and needles on your back. I would just crank it right up when I had a contraction. And I think I was swaying. I was just in our bedroom laboring. My dog kept coming in and out, which was annoying, but also quite adorable.
Cute.
I had country music playing. I was just trying to just get into this zone of just being as relaxed as I could. Yeah, trying to change positions a lot, but really nothing was comfortable during the contraction. So in between contractions, I would get on my hands and knees, or I would do squats, or I would just lay down. And then as soon as the contraction came, it's like I had to jump right out of bed and just stand and move. And I think about maybe another hour later, 4 o'clock or so, things were really intense. Like I was screaming. I think I was having like 4 contractions in 10 minutes. I was starting to not cope so well. And so I called the midwife, and I remember that conversation, I had to stop and breathe. And she said, oh yeah, it sounds like you're definitely in labor. I should come to your house, see you. And, another half hour goes by and I'm thinking, if she doesn't get here in 2 minutes, like, I don't know what I'm going to do. This is so intense. And I was doing my breathing. Like I had really focused on breathing and, releasing, like opening, just keeping my pelvic floor really open during the contractions, which is one of the things the pelvic floor physio recommended, which I found quite helpful. And then I think the midwife came in about 4:45, and she came and I just like whipped my pants off, hopped on the bed. I was like, you need to know where I'm at. Just tell me. The look on her face, I thought I was 3 centimeters, and I thought I was just having, a posterior labor that was super intense. And she pulled her hand out and just ever so calmly said, you're 7 to 8 centimeters. We should get to the hospital. You also have bulging membranes, so make sure you have lots of blankets and pads in the car. And I just thought, I was like, okay, I need to go. I was terrified of the car ride. It was the worst car ride of my life.
And how far are you from the hospital?
Only about 15 minutes. but it felt like an hour. My poor husband was plugging his ears. I was screaming. So loud. I didn't have a seatbelt on. I was just kneeling in the back seat. Nothing was comfortable. I wanted to be standing, and you obviously can't stand while you're driving. We get to the hospital, and I just pretty much just want to run up to labor and delivery. I'm like, let's just get this over with. Let's just have a baby. I'm so uncomfortable. I don't know. It was so intense. So much back pain. I guess I haven't spoke of that. So much back pain and lots of pressure. And yeah, we get there. I remember seeing who was working and just walking by, just like bolting to the labor delivery room, whipped off my pants and everything. I just whipped off the clothing. I was so uncomfortable. I just wanted to be like as naked and as free as possible. And I think I got there at 5:30, and I remember trying laughing gas and pretty much like gently throwing it across the room. Just made me feel awful. My sweet coworker tried to come up and rub my back, and I was just like, oh my gosh, get away from me. I need space. I labored exactly how I thought I would. I thought that I would want to be alone, not touched, just kind of do my own thing. That's kind of how I am if I'm in pain or I feel nauseous or anything. So my husband the whole time he just kind of stayed away, and he'd come and check in on me and ask if I wanted him around or anything. And then once we got to the hospital, he just kept handing me water, and he was really great. And yeah, I think I was GBS positive, and I knew that I was really close to delivering, and I thought I could not imagine standing still for an IV. So I did actually decline the antibiotics at that point, which is funny as a labor delivery nurse, got all that knowledge. And then I remember pushing, I was just involuntarily pushing, and I thought I was pushing my daughter out, but it was my waters. My waters just burst all over the floor. I think this was about 6:00. And it's funny how even though you're in all of this intensity, you can still look up at the clock and remember the timeline. I didn't have a long experience, so I guess
But it is interesting how that happens, hey?
Yeah, it is interesting. Or I remember looking over at one time, checking that the oxytocin was drawn up and that the baby warmer was on, and it just couldn't shut the nurse off of me. And then I was standing still, involuntarily pushing. And I know the midwife that I was delivering with loves delivering while someone is standing. And I thought, oh, she's going to love this. And just so much pressure. Holy, then I actually started to push. And I thought that the pain would have gotten better, but it got worse for me, which I find kind of funny because I always tell people, once you get to the pushing stage, there's something to focus on. You get to, the pain gets better, it gets less intense. You really get to put all that pain into something good. And it just got worse for me. I just remember kept yelling out, oh, the pain is worse, it's worse. I just want it to go away. And I got down onto the bed, I think on like my left side, and it's so fascinating. I could feel her coming down. I could actually feel her descending when I was pushing, which, you're getting excited. I had no idea that I would experience that. And then 6:30 she was born.
Wow.
Yeah, very quick.
That is quick.
I did have, which I thought was very helpful. I thought I wanted the mirror to see her descending, but I actually put my hand down there and I pushed into my hand, which was very, very fascinating. And I think that mind-body connection was really helpful. She was born with a little hand up by her head. She was born safely, and she cried right away. We were getting fussy. And yeah, I gave birth in a room full of love with my coworkers and my husband and my midwife, and it was a wonderful experience.
I know, it's so special. Hey, like when I had my son, I had a vaginal delivery, and my daughter, who's the second, I had an emergency C-section. And a lot of people were like, well, what was it like kind of, delivering with your colleagues who everybody? And I said, it was amazing because I trusted them. I knew them. I felt safe in that environment, where I think some people maybe feel shy, would think that they would feel shy around their coworkers. But when you work so closely with people doing deliveries all the time, it's just a different perspective, I find.
Absolutely. I felt very safe and very excited to be giving birth with my friends, really.
Yeah.
Yeah. A room full of friends, which not many people get to do that, especially during COVID.
Especially in the middle of COVID. Yeah. Hey Sarah, do you remember all of those questions you had as a new mom? What car seat should I buy? How do I start solids with my baby? Do I cloth diaper or use disposables? How do I care for my newborn skin? What kind of birth control should I use postpartum?
I sure do. I know for me, one of my hugest supports postpartum was my network of mom friends who had been through it themselves or were going through it with me. The sleep deprivation, the breastfeeding challenges, the baby blues, you name it.
Agree. The support of a community that you know and trust and has been through the challenges of postpartum or is going through it with you is so important.
That's why we created the nesting community. I'm so excited to launch this community. Alicia, why don't you tell our listeners what it's all about?
I would love to. We're teaming up with Dr. Pip from Making Mama Well to build the nesting community to help you prepare for the 4th trimester and beyond. Are you wanting more information on how to prepare? Feeling anxious about all the different options and what to choose? Are you looking for a group of like-minded mamas for support and to lean on each other during this challenging but amazing season of your life?
We'll be having monthly guest experts covering topics from baby wearing to breastfeeding challenges, from postpartum contraception to traveling with your baby. Yes, this pandemic will end.
So come on over and join us at www.shefoundhealth.ca.
See you in the nesting community. Check out the link in our show notes below.
So sounds like a lovely, safe, healthy delivery. Brinley kind of was up on your belly. Brinley's just gotten hungry, so she's feeding right now. How did your breastfeeding journey go postpartum? How did everything go from that?
My breastfeeding journey. I have a story for
Great.
that. Yeah. So, I mean, for the first about 6 to 8 weeks postpartum, things were really well. Things went really well. I just kept saying, okay, when is the ball going to drop? This is almost going too well. I had noticed at birth that she had a tongue tie and a lip tie, but she was gaining really well. I seemed to have an oversupply of milk for those first couple of months. And then fast forward to, I think, 2.5 months, I started to notice, my boobs don't feel as full as they were. She was sleeping quite good stretches. I don't want to make other moms out there feel so bad, but she was sleeping about 8 to 12-hour stretches, which, the nurse in me should have known. I shouldn't have let her go that long, or I, should have been pumping in between at least or something. But I started to have a drop in my supply. I think I made a doctor's appointment at 3 months. I started to have a drop in supply. She wasn't gaining weight super well. I think she maybe gained 2 ounces in that 1 month, from 2 to 3 months. I noticed her tongue mobility wasn't as good. And I thought maybe all of this was just, my milk supply regulating, after those first couple of months. But I really do think it was probably her tongue tie. She's sleeping too long. She wasn't stimulating me as much. So I went on domperidone. I saw the lactation consultant. My family doctor, who's also a maternity doctor, clipped her tongue tie. Immediately saw great results with the tongue tie clipping. And then it grew back within a week. And then her tongue mobility got even worse. So, she went and saw some chiropractor, which was great, actually. After one treatment, the next day, it was like she was showing off with her tongue. It was sticking out like crazy. But she still wasn't gaining weight very well. So we had to get it re-clipped. And then my doctor suggested that I got it done more by a dentist, a specialist who does 3 month plus old babies often. I couldn't get in anywhere on the island soon enough. So we actually traveled over to Vancouver and got it done and had a wonderful experience. They used laser. It was a very quick and seamless procedure. She breastfed immediately after. However, her tongue tie did go back about 3 weeks after that. Little trickster. I did get her lip tie clipped as well, and that has stayed. But I think she's seen the massage therapist for cranial sacral therapy and chiropractor a couple more times, and her tongue mobility is great. We do a lot of oral play and oral exploring. So while all of that sounds okay, she's still teeny. And now I think I've come to the conclusion that she's just a tiny baby. She's almost 5 months old and she's not even 12 pounds. She's a 3rd percentile kiddo, but she's happy and healthy. And while I can share this story, I have never felt so much worry and anxiety. I've never cried so much. I have never felt not like myself. I was just talking to my husband last night and I asked him, have you noticed that I've been more like myself over the past couple of weeks? And he said, oh, absolutely. And it's funny while you're in it, while you're worrying, while you're crying, while you're fretting, while you're so emotional, no matter what anyone says, you just still feel all of those feelings. And then when you feel better one day, you realize, wow, I had no idea how bad I felt. I was talking to friends, talking to my husband, talking to my parents, daily, telling them about how awful I was feeling, but you don't really realize how awful it is until you do come out of the light.
Yeah,
I wondered.
Yeah, we hear that not infrequently in terms of when you're in it, you just don't know you're always in it. And so
Mhm.
oftentimes in the office, we'll ask because we've met people throughout their pregnancy. So if we're sensing a change, we'll often ask the partners what they think in a way
Yeah.
that is, we're allowing them to speak freely within a kind of a trusting relationship, because it can be hard for partners to say, you know what, I'm really worried about you, or I really see this change in you, because oftentimes that postpartum person doesn't necessarily recognize it and sees it as a negative thing when their partners say that. And so they have a huge perspective. And so we'll often talk to the partners if they're coming in with their postpartum person to kind of get their perspective. Because it's true, when you're
Mhm.
in the middle of it, you often don't see it. And it's not until you come out and then look back that you gain that perspective.
Absolutely. Yeah. And I knew that I was anxious. I even wondered, do I have postpartum anxiety? Do I have postpartum depression? I was telling everybody under the sun about my feelings because I wanted to normalize it so much as well. And talking to other new moms, I'm lucky. I know about probably almost 10, good friends and old friends that have had babies around the same time as me. And in talking to them, they're all experiencing something similar. So I thought, okay, so I'm normal, but what do these thoughts mean? Should I stop breastfeeding? Should I formula feed? Would that make me feel better? Would that take away the anxiety and the worry? Or, what is the right decision? But I really, yeah, I think that just coming to terms with the fact that she's a smaller baby has been really cathartic for me. At
Yeah.
least I
And
hope that she is. she's
yeah. And you know
she's
what?
staying just at her own page.
As long as they're staying on their own curve. So when we see babies, we
Yeah.
see them certainly. And I'm realizing that other places, I think we're quite a special places, are communities that have family docs or midwives who do kind of the postpartum and the newborn care, right? And we do
Yeah.
close follow up. We see people and the postpartum folks and their babies at 1 week and 2 weeks and 4 weeks and 8 weeks. And then our clinic, we see them at 3 months and 4 months and 6 months. So we can follow that
Oh,
growth and that
wonderful.
trajectory, right? And so as long as babies are on their curve and they're gaining on their curve, both my babies were third percentiles. I think I produced skim milk, but
Yeah.
they were growing on their curve. They were 99th percentile and 99th for height and third percentile for weight. They were these skinny little humans, but they were gaining on their own kind of curve. But it's true, it's very anxiety provoking, and everybody wants that like 50th percentile, but there's only so many people who can be on the 50th percentile. So as long as your baby is growing, that's what we need to know, and gaining appropriately, right? But
Yeah.
yeah, you just can't be prepared for that kind of postpartum
You
concern about your
cannot be,
baby. Even if
no,
everything is going like perfectly, swimmingly, smoothly, there's going to be something you're worried about, because that's just the nature of being a parent, right?
yeah, I was not prepared for postpartum
Yeah.
at all. The emotions, the worry, also the joy and the love and the happiness, but yeah,
Yeah. It's crazy.
lots of feelings.
So, what we always ask everybody this, but what if you were to say, what is the most special thing through your journey? What is that like one kind of thing that you can say, oh, that was kind of the best moment or the most special moment? Brinley is like staring at me through Zoom. Hi, sweetheart. She's so
She
cute.
loves FaceTime, video chat. I would say the most special thing was honestly just my whole labor and delivery experience. Really having that birth that I manifested and then giving birth to a healthy baby in a room full of love. I
Amazing.
say it was magical now. However, I was reading through my notes last night and I said my birth was anything but magical. It was intense, is what I wrote.
Sure. And it is when it's that quick, right? Right.
Very intense. Yeah.
And then what was your biggest challenge?
My biggest challenge throughout everything, or I would say the emotional struggles with her, like the breastfeeding aspect of it, the milk supply worry, the weight gain worry. That was definitely my biggest challenge. And not comparing her to other babies.
Yeah. Yeah.
Mm-hmm.
Right.
Pictures of those adorable 99th percentile chunky babies.
Big chubbalubs. And what piece of advice would you give people listening to this podcast who are pregnant?
Not only on labor and delivery, because that's actually a really small portion of the whole journey, but educate yourself on breastfeeding, newborn sleep, talk to your friends, try to understand what it's like emotionally to become a new parent. But really nothing can prepare you for that. But just do as much education as you can and be open to a birth not going as you maybe hoped, because it is the most unplanned moment of your life.
Yeah, totally. And I agree wholeheartedly with you. That's what we do, prenatal course, and we have a huge piece on that postpartum. Like it's half the course, more than half the course, is because it's such
Yes.
a big piece, and people focus so much on the labor delivery and not that kind of postpartum, that fourth trimester period, which is by far for many people the most challenging, because it's very hard to prepare for, and most people don't think about preparing for it. So yeah, I think that's great advice. Well, Lanie and Brinley, thank you so much for joining me today. It's been an absolute pleasure.
Thank you.
All right. Take care. Enjoy the rest of your day.
You too. Have a great day in the sunshine.
I know, right? Bye, Miss Brinley.
Okay. Bye.
So cute. Congratulations. So
Thank
cute.
you.
All right. Take care, and thank you for doing this.
Yes, anytime. I love sharing my story.
Awesome. Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood, and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.